With COVID-19, we're bringing in Dr. Ajay Kumar from Hartford HealthCare.
Dr. Kumar, thank you so much for taking the time to join us. We just heard from Dr. Fauci there a second ago saying that he's worried that the already steep rise is only going to get steeper. What do you think as far as Connecticut's curve is going? I know, at least just looking at hospitalizations, over much of November, it was rising much more gradually than it was back in March and April. In other words, we were flattening the curve, but now, over the past couple of weeks, boy, it seems as steep as it's ever been. How worried are you?
Well, good morning. Dr. Fauci spoke very well. I think there is a concern after the Thanksgiving to have some sort of a rise throughout the nation, especially in Connecticut as well. Now, just want to remind, back in August and September, we had seen a significant decline and almost contained the spread of the virus significantly in Connecticut. And since then, since October, we have seen a gradual incline of the curve. In the last several weeks, 2 or 3 weeks, we've seen a little bit more rapid at this time. I am concerned. This is going to continue to rise, and we're going to see a further increase in cases. And unfortunately, mortality in the state of Connecticut as well. And this was something we were worried about that earlier on as winter comes in, Thanksgiving and Christmas comes in. Hartford HealthCare and I would imagine every single health system in the state of Connecticut is preparing for that increase. And we feel we are prepared at this time to manage whatever is to come. And I think, as always, we'll get through this. I have full trust in our capable healthcare workers across the state, and we'll manage it. But this is the time for all of us to be aware of social distancing and hand hygiene and limiting travels and other things, which we've been talking about from the beginning.
Do you think strict guidelines are needed again to help flatten the curve?
I think the governor's task force, in my opinion, has been very prudent in making decisions so far, and I think they've divided the cities and towns in different zones accordingly. I like to believe that Connecticut residents are very responsible. I would imagine that most people will follow the right advice and do the right thing. There's always a challenge in finding these guidelines to strike the right balance, such as education for the kids and making sure that there is a appropriate containment measures happening. So I feel at the moment we're comfortable with the guidelines where we are right now. However, the guidelines can only go so far. The citizens really need to follow the advice, the travel advisory, and other limiting social events, which unfortunately are the cause for the significant spread lately in Connecticut.
Given where we've seen hospitalizations go now at 1,100, getting closer to that peak of 1,972 back in April, do you now suspect we may surpass what we saw in terms of hospitalizations back in March and April?
The modeling has always been a challenge, especially this time around. It is a significant challenge. As you know, we've been working with MIT, and we look at a variety of different models. And this time, the modeling has been very challenging. This has changed quite a bit from 3 or 4 weeks ago when I started. I mentioned in the media at that time here. I expect we'll be at least the same or a little higher at this time, but it's difficult to tell. I think we will have a much better information early next week when we start seeing the Thanksgiving travel effect and the positivity rate in the Connecticut. Whatever the numbers are, that's going to be more telling. I think it's a little too early to tell where we're going to land, but we will learn more next week.
All right. Dr. Ajay Kumar of Hartford HealthCare, thank you so much for your time and also for your insight.